Hi, I'm Doug Wulf.
And I'm Shannon Kuehn.
We're two of the nurse practitioners here at Kearney County Health Services, and it's been a little while since we posted a video to Facebook, but we wanted to take a minute to kind of give the community an update about what we're doing and some of the most recent updates and some of the changes that have been happening with the COVID-19 pandemic. We have been working very closely with many of the people and authorities within our community, including law enforcement, local EMS, and the school, especially given the fact that we have school coming up. We feel that that's fairly important. Shannon's going to give some information on that. But I wanted to take a minute just to give an update about some of the things that we're doing here specifically at our facility as times have changed and the pandemic has kind of increased in complexity for us. One of the things that several people have probably realized is that we have had to modify our testing ability here because of the increase in the number of COVID positive patients that we've seen not only in our area but nationwide. As a result of that, we have seen a decrease in the number of either tests that are available to us or some of the reagents that are used to process those tests. And that's certainly been something that we've been impacted by here. So as a result of that, we have been mandated to limit the number of tests that we're able to perform on a daily basis. Currently, we only have the ability to do 6 each day. And because of that, we're having to be very selective about the patients that we're able to see and the patients we're able to test every day. So we're trying to triage those patients and kind of picking, for a lack of better terms, the sickest of the sick and making sure that those are the ones that we're able to get in and monitor. So if you call in, we're going to have nursing staff that are going to triage you still, just like we have in the past. If you are somebody who has been bothered by symptoms that are along the lines of those that we would see with COVID-19 patients, we're going to work our very best to get you in to be seen in our clinic, if not that day, the next day, and utilize those 6 COVID-19 tests that we have available to us in the best way possible. That's our effort to try to not only contact trace and figure out community spread, but just to keep you healthy and keep the community as healthy as possible. One of the other changes that we've had to implement here as a result of that and the limits that we're able to, or the limits that have been placed on us, is we're no longer testing for doing pre-procedure testing for patients that are coming in for routine surgeries or other procedures. In the past, up until about 2 to 3 weeks ago, in order to keep everybody safe, we were testing everyone prior to coming in and having procedures done. That was a practice that was in place almost globally, certainly in this region. Because of the changes that have recently been made, we've completely eliminated those with the exception of 1 or 2 types of patients, and we'll help to identify those patients if they come up. So you may have a procedure that's upcoming where we will tell you it's necessary to have a COVID-19 screening done. But for the most part, we are no longer doing those, and that's true both here at our facility and at most of the facilities around this area.
The other thing that we have been working on a lot over the last couple of weeks is we've been working close with the administration and staff at Minden Public Schools to make sure that kids and teachers and the staff go back to a safe learning environment this school year. We kind of wanted to touch base on that today and encourage all of you as parents, students, or even staff members to help be active in that process so that we keep everyone safe in our community as best we can. The school has been sharing some of the information to the public as we work through those recommendations, but we want you to realize that those are constantly changing, as we all know with COVID-19, as we learn more. Currently, the school, with the guidance of us and also working with Two Rivers has decided that masks will be optional, but we are encouraging their use as many kids as can if they tolerate them and if it's age appropriate. We also encourage parents to help start working with your child on practicing social distancing, making sure they're performing good hand hygiene, making sure they're using the hand sanitizer available at the school, or if you send some with your child to school, that's great too. We want you to really be a partner in this with us and help reiterate the importance of that as a first line of defense for the kids at school. We also are asking parents to closely monitor your kids this school year for any of the COVID-19 symptoms that we're all familiar with: the fever, the cough, the congestion, shortness of breath, change in taste or smell. And of course that along with that comes monitoring the temperatures. And right now we're asking parents to do that at home in the morning before you send your child to school. If they're showing any symptoms, we also request for you to please make sure you keep kids home when they're sick. If they're not feeling well, it's imperative that you communicate that with the school and the staff so that they are able to help guide you. Our recommendation right now is that they will then have you contact one of us here at the facility to work through the triage of those patients and determine who needs to be seen to help slow down the spread of the virus if a child does come down with it. We ask that after you call your kid in sick to the school, you just call up to the clinic. One of the nurses will work with you through the phone and determine who needs to be come in to be seen and who maybe needs to monitor at home or what we need to do. As Doug discussed, we don't have an unlimited supply of tests right now, and so testing will not be required for a child to return to school, but some kids will need to be tested if they're showing the appropriate symptoms that would be consistent with COVID-19. So we'll help determine that with you as parents and try to make it the safest environment for all the kids to continue learning. I think as we get back into the school year, that has been the main goal for us as a healthcare facility as well as the school administration, is we really just want the kids to be able to have a safe learning environment, and we want all of you in the community to be to understand that we're working closely with them so that that can happen for our kids. Please don't hesitate to contact us here at Kearney County Health Services with any questions or concerns. We greatly appreciate everyone working together to help limit the spread and to protect those vulnerable in our community. We hope you enjoy the rest of your summer and have a great school year.